A surge in the UK of rare severe myocarditis in newborns and babies has been cropping up. And although side effects of COVID-19 and the COVID vaccines have included myocarditis, the focus instead here by the World Health Organization is on enteroviruses. They are suggesting a possible outbreak. Now, myocarditis is an inflammation of the heart muscle. The most common cause of myocarditis is viral infection, like enteroviruses, but it can also be caused by a bacterial infection, a reaction to a drug, or an autoimmune disease. Myocarditis symptoms include new and persistent chest pain, shortness of breath, and heart palpitations, meaning racing or pounding heartbeat. So we're going to take a look at what is going on here. And so from Trial Site News, I am Adrian, and our episode is starting right now. So, the World Health Organization, or the WHO, recently reported that incidence of myocarditis led to the death of a baby and hospitalization of an additional 9 newborns and infants across South Wales and southwest England from June 2022 up until March of 2023. The incidence of myocarditis in babies peaked in November of 2022. In total, the World Health Organization reports 15 babies, including 10 in Wales and 5 in England, were diagnosed with the inflammation of heart muscle, often associated with both SARS-CoV-2 infection as well as the COVID-19 vaccines. But the condition can arise from other viruses, and in fact, 9 of the babies were diagnosed with enterovirus, which is the virus behind respiratory illness, hand, foot, and mouth disease, as well as viral meningitis. Now, reported across multiple British media outlets, the diagnosis of myocarditis associated with any of these potential triggers is indeed very rare in babies. Back on April 5th of 2023, the National IHR focal point for the United Kingdom informed the WHO of an increase in severe myocarditis in neonates and infants associated with enterovirus infection in Wales. Between June of 2022 and April of 2023, 10 neonates under 28 days of age presented with a picture consistent with myocarditis and a positive enterovirus PCR. 7 cases were treated in intensive care, and 1 case died before transfer to tertiary care. Cases presented with features of sepsis, myocarditis, or in cardiorespiratory arrest. The peak incidence of cases was in November of 2022, with sporadic cases in other months. Now, enterovirus PCR testing of all 10 cases with either blood, throat swab, nose swab, nasopharyngeal aspirate, or cerebral spinal fluid samples confirmed the presence of an enterovirus. Critical care support, including intubation, ventilation, and circulatory support, was given to the patients who went to intensive care. As of May 5th, 2023, 1 patient was still hospitalized and 1 had died. The reported increase in severe myocarditis in neonates and infants associated with enterovirus infection is unusual. In the tertiary hospital covering the South Wales region, 2 other similar cases have been identified in the 6 years prior to June 2022. A further 5 cases have been identified over the same period in the southwest of England. No additional information is currently available about these cases. Details of 5 of the cases from South Wales and 3 of the additional cases from southwest England have recently been published. Now, as I mentioned earlier, multiple media outlets across the UK have reported on the WHO announcement, with numerous experts commenting on the matter, and none of them citing the potential for COVID-19 nor the mass vaccination program implemented during the same period that the surge of cases was observed. Because of course not. That would be ridiculous. So what is the pathogenicity then? Well, as of right now, we don't know. You see, one visiting professor of pharmaceutical medicine at King's College London, Dr. Penny Ward, informed The Telegraph that health officials have declared that there will be an investigation into any changes in pathogenicity of enterovirus based on the recent cases. Dr. Ward, quoted in The Telegraph, account of the WHO publicly disclosed observation and mentioned that it was, quote, quite possible that the increase in rare myocarditis cases in the newborns and babies had to do with a broader enterovirus outbreak occurring since COVID became less of a problem. But no one can be certain, said Dr. Ward, given that, quote, we do not routinely look for these viruses in the population at large, making it difficult to know. Now, the World Health Organization reports that enteroviruses can cause a number of infectious illnesses and are responsible for annual epidemics. These are usually mild, but have been found to affect neonates differently, and often more severely than older children. There are multiple transmission routes, particularly in the neonatal period. The reported incident represents an increase in both the number and severity of enteroviruses or Coxsackie viruses infections in infants under the age of 1 month. There is an increased morbidity and mortality associated with the current incident. The Global Health Agency, which has both gained power and worldwide influence during the COVID-19 pandemic, but also finds itself at the center of growing criticism, reported that no specific antiviral therapy is available and treatment focuses on prevention of complications. As of now, there is no vaccine for enterovirus, and the WHO informs health authorities that controlling measures should focus on, quote, classic hygiene measures, from frequent hand washing and disinfection of soiled clothing and surfaces. The World Health Organization harkened back to COVID-19 and raised the specter of shutdowns in certain situations, such as the closing of childcare facilities and schools so as to reduce the intensity of transmission. And the World Health Organization does not recommend any travel and or trade restrictions to the United Kingdom based on the information available for this event. And naturally, of course, we'll be keeping an eye on this situation as it continues to develop. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written articles published every day, feel free to visit us at trialsitenews.com. And as always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.